Welcome friends to another episode of HomeOmithra Vartalap. Today's topic is about content writing. So why not speak to someone, get the knowledge from someone who is an expert with nearly 2 decades of experience in content writing. Welcome Dr. Surat Dirwani. If I may introduce you, he is the founder of the firm TechnoMedix, and they've been working with doctors as well as those who are not doctors since many years, and they have extensive experience in content writing. To keep it in to give it a parallel understanding, let's say you have a doctor who is a specialist in heart, and within that you have a doctor who is a specialist in valvular surgery or pacemakers. So Dr. Surat Dirwani is the super specialist of content writing. Welcome, Dr. Surat.
Thank you. Thank you so much, Dr. Kevar. Very happy to be back again on HomeOmithra Vartalap once again. One of my favorite platforms, and I love watching all your content because the insightful ways where you delve, it's such a pleasure and a treasure for us to sit at home and watch whatever you're bringing for us, this treasure trove of knowledge.
Thank you, Dr. Surat. Thank you very much for that. So we'll proceed with the Q&A for today's podcast. So Dr. Surat, for starters, what is content writing broadly and where it is used? If you could just give us a fair idea of the concept.
So content is everywhere. Okay? Your content is literally omnipresent, and it's not something new. From the olden newspaper till current newsletter, from your brochures, from your flyers, whether you're eating a packet of chips and you're reading the ingredients or the nutrition information, whether you're reading a book, whether you're reading a blog, whether you're reading a social media post, the caption under the post, the script for the post, there's content everywhere. Every tweet is a content, so to speak, and every blog post, every post that used to be once upon a time on a wall is content. So uh, from your visiting card to your clinic board, there's content. So it sounds like I'm going about like a very theoretical, dry definition of content, which is very tough to kind of encompass into one word. If it informs, persuades, or engages in any way, it is content. It is the voice of the business. It is the soul of marketing, and it is the bridge between a brand and its audience.
Fantastic. I think you have simplified it and broken it down to that extent that now everyone, even someone who has not heard of content, would probably understand that. Now, moving on to the next question, what is the difference between content writing and medical content writing? Particularly this question because you are a doctor, you have worked extensively with the medical fraternity. So if you could tell us something about that.
So, based on the examples that I just gave you, content is everywhere, right? So, content speaks to the masses predominantly. Content is in everything. But when you talk of medical content writing, it is a niche, just like you kind of introduced me. It is a niche inside content writing, which speaks directly to patients, doctors, healthcare professionals, or centers itself around the medical field. Now, which again is very vast, whether it is med tech devices, whether it is the hardcore healthcare industry, whether it is some disease condition that you're looking at, whether it is a case presentation, whether it is a brochure, whether it is a social media post, all of that would come under the purview of medical content writing. A regular content, for example, a regular blog that you put out or a regular tweet that you put out, may not be subject to so much scrutiny. But medical content writing is far more scientific in its approach. It demands more technical accuracy, scientific correctness, and therefore it is governed by certain regulatory frameworks, certain policies, certain laws, and it speaks to a scientific audience.
So Dr. Suraj, so then when doctors dance in front of the camera and they try to show and educate people using some funny memes and all that, does that translate to
What the doctor does not translate to content writing, but what's visible on the screen, someone somewhere is writing that content, right? I mean, when they are doing that PCOD, what you're mentioning as symptoms of PCOD, for example, is medical content writing. Either it's being done by the AI or the doctors doing it themselves, or they're just taking something off what is available. But what you're saying there invites a certain amount of responsibility, Dr. Kevar. You cannot be fear mongering there. You cannot be unscientific there. and therefore medical content writing, if that content has been written by a medical person, then it will not be unscientific. But if your social media manager is going to write content about PCOD, might take the use of ChatGPT or whatever, but I would not call that medical content writing. I think there is a sense of responsibility when we talk of medical content, and irrespective of whether the doctor dances or sings, if the point that you're trying to convey is accurate, is scientific, then I think you're still under medical content writing.
Interesting. So what we will do is we'll leave the link to the previous podcast, which is in which Dr. Suraj has spoken at length about the legal aspects, ethical aspects also, and there is one more thing I recall from the last podcast is being a content consultant. He has spoken about that also. That what is the importance of a content consultant, and particularly so when you are a doctor. Now somehow I feel, correct me if I'm wrong, you need a doctor as a content consultant when it comes to creating medical content.
So that's been since a while. Honestly, it's where it started in some sense that not every doctor is a creative writer, right? So there would always be those who are better at creative writing, which involves a lot of marketing terms. There's IDA, you have attention, interest, desire, action, as which also has evolved as a concept over the years. But someone who is writing, copywriting a marketing content would structure that particular blog or advertisement in the AIDA format, which not necessarily is the doctor's forte. But that content, if it is a medical content, for example, if it is an ad for a particular toothpaste or a soap, or it is a blog being written, multiple sets of blogs being written on, let's say, diabetes care, or even hair fall, to ensure that it is scientifically accurate, to ensure that it is medico legally compliant, to ensure that there is no fact being misrepresented, or even to have a sum of some research papers that you pick up and string together a sentence. The sentence still has to make cohesive sense, and to interpret that well, you do need a doctor. And even today, that bit of being a content consultant has now actually evolved into where doctors have a better understanding of the practical scenarios on ground. For example, as a company, if I am trying to launch, let's say, some set of herbal teas, which were all the rage during COVID, but as a marketing person, if I go out to do a market research, vis-a-vis, they do come up to us and ask for our participation or opinion in the sense of which of these teas should be packaged in what way, or would it be accurate to say that XYZ can treat. We would never allow the word cure, as you recall from the last podcast, would be able to treat or elevate the symptoms if there is any scientific evidence for the same. If we have any practical anecdotes of the same, that in our practice, if we have seen something like that. So, for all doctors, that opportunity exists where they are sought after in terms of being content consultants. But it's not just having the knowledge of what is happening, vis-a-vis being aware of what impact it has for the brand and the audience who's going to engage with it is very important.
Correct. So I think what I gather now from this brief discussion is that, from what you have told us, is that there is a lot of finesse that is involved in curating content when it comes to medical content. Right from grammar and sentence probably is one thing, but the scientific accuracy and it being technically sound is something which is like which I think I've perceived it right as a super specialty is medical content writing.
That's correct, Dr. Kure. I mean, there's a lot that goes beyond than just stringing a set of words together. There's a lot of things that we must be cognizant of, whether it's keywords, references, plagiarism. There's more to it than just writing creatively.
Right. So this will lead us to the next question, which is more specific, I presume. What is the difference between medical content writing and medical writing, also known as medical regulatory writing or scientific writing?
Correct. Very well put, Dr. Kure. Medical writing is the regulatory writing, the scientific writing that you might write for journals, for case presentations, for research papers, the kind that when you have a new molecule being developed or a new vaccine being developed, and then there's that whole bunch of literature. And again, this is done exclusively by doctors in most cases. Sometimes also B.Pharm, M.Pharm graduates would also be giving their precious opinion on the same or writing for the same. So that's that's governed by a whole different set of ethics, laws, regulations, is very, very technical in its nature, and almost has zero scope of creativity, to be honest. You have to follow a very set structure. You cannot skip something. Every word has to be documented in a particular manner. Whereas with medical creative writing, as the word kind of suggests, there's a lot of creativity, there's a lot of scope for creativity. Now, whether it is a video script, whether it is a blog post, or usually hundreds of blog posts that are brought to bring about a certain impact in terms of SEO or brand building or brand awareness. You have educational brochures, flyers, you have infographics that are kind of distributed to convey a message. You have social media content. All of that would be under medical creative writing, where we have certain creative liberties, and it can be engaging, it can be fun to write, it can be challenging, and yet it has to be scientifically accurate.
Well, that's quite a classification, and I can only imagine what goes into actually creating something like this. Which brings us to the next question. What qualities should a content writer have?
See, over the course of the last close to 2 decades, I have no qualms in admitting that when I started writing, I perhaps didn't know what this means. The reason I started writing was because I thought I was a good writer, right? I had a few blogs, a couple of those poems or articles published in college magazines, and you feel, oh well, everyone's appreciating I write well. But that's writing. That's writing. If today I go back and look at my own blogs, I can spot so many mistakes, and I'm sure others do too. But that was 10, 15 years ago. Vis-a-vis today, for anyone who's aspiring to be a writer versus a medical content writer, there's a very there are few commonalities that one would need. Obviously, you need to have a good command over vocabulary, a good sense of language, whether you're writing US English, UK English, English India, a good grasp of grammar, a good working understanding of grammar. Yes, there are tools for all of these, but this is, I think, what basically any writer would have. Nothing different there. But for a medical content writer, you, beyond having an eye for grammar and the verbiage, you need to have a better understanding of the brief that your client gives you, or whether you're writing for yourself. You need to understand, are you writing for yourself, are you writing for a particular audience, what is that target audience, what is their demographic, what is the condition that they're looking for. If you continue down this path in this field, then you really need to have that curiosity to learn, because the medical field by itself has so many advances that are happening regularly. There are challenges sometimes we face. We have to write for a medtech device. We didn't even know such a device existed, that it measures this particular parameter to this accuracy. But then you have to learn, and then you have to understand what is it that the client is looking for to convey in this message. How is this going to be useful to a particular set of people? And then structure your messages, your content accordingly, whether it's a social media post, whether it's the blog post, whether it's just a newsletter that's going out in the same company. But then you have to kind of understand what is the ethos behind it. And I think again, it becomes too vague. So, and we are homeopaths, so we like, three-legged stools. So to bring it down to 3 points, what a good content writer, a good medical content writer should have, I would say good communication, adaptability, and a structured way of working and approaching the brief.
So now these are the broad qualities that content writer should have. Are there any technical skills that they should be having when it comes to content writing?
So yes, this is what I just described makes you a good medical content writer. But to become a successful medical content writer, there are a lot of relatively new terms that you might not be aware of, that you would have to be familiar and cognizant with, like SEO, search engine optimization. What is that? What does it stand for? Search engines, and are there other search engines apart from just Google? How are they tracking that content? Then you have your references. What kind of references are being asked for? What style do you need to get into? Chicago, Vancouver, APA. You have keyword research. Keyword research is an essential integral part whenever you're writing for a particular client or writing for a particular objective. And how do you track keyword density? You can't work with keyword stuffing. So how do you take long tail keywords? How do you fit that into a sentence? And while doing all of this, Plagiarism, because 70 to 80% of this kind of medical content is going to find itself on the internet. And if you're looking at the internet, you have to be plagiarism free. You cannot just copy paste sentences and string them together. So you need to have a plagiarism checker. You need to understand that you are falling under certain parameters. Otherwise, the entire effort, which will backfire for the client or for yourself after a couple of months, when the SEO does not work, is all a bit of a waste, right? So if I'm to put it very succinctly, you do need to, of course, have grammar, and you need to have vocabs and better terminology, and of course a core understanding of medical jargon. That's why you're a medical content writer. But at the same time, technical tools such as formatting, Google Docs, Word, Grammarly, and all of these tools. So it's a very fine balance of art and science, where the art part, just like homeopathy, where the art part is how you're creatively putting across your message in the least number of words. Sometimes you don't want to drag too long, and at the same time you need to be fresh, innovative, plagiarism free, and you need to find a creative way of how you're going to say the same thing that probably 10 others have already said out there, but you've got to say it again in a way that is plagiarism free, matches the keyword density requirement, and serves the purpose of SEO or being engaging content on social media. So these skills are something that sometimes a content writer has, but they can learn, they can refine, and they can develop these skills over a period of time.
No, but then if one learns the skill, one would also need the tools to apply those skills. What would those tools be?
Right. I mean, of course. So a lot of what I mentioned in the previous question is related to a lot of softwares and tools. Of course, even today, even if you don't know grammar well, you have a tool. You have something like Grammarly, which will correct your grammar. You would know tools like, of course, your Google Docs, Microsoft Word, word count, and the basics. But the advanced SEO research, the keyword research, will need good tools such as SEMrush, Ahrefs. ScaleNet is another tool we use a lot. For plagiarism, you can use something like DupliChecker. Small SEO tools, you can use Quillbot to help you with your creative writing. I think the list of tools is actually endless. To be honest, when we come across a new tool, we have to wonder and ask ourselves, what is this particular one doing better than the other, and how much does it elevate my writing? Because there comes a time where you don't want the tool to be dictating what you do. You want to have your creativity also flowing somewhere, and all of these tools are available in a freemium model, where they at least give you some amount of data, and the rest of it is obviously behind a paywall or a subscription, which can be quite a fair bit, to be honest. So someone who is thinking of kind of setting out on this journey might find themselves with a small hurdle, small obstacle to get there. Then of course you have AI, right? In amongst all these individual tools, someone like ChatGPT will suggest something which has keyword research already baked in, but it doesn't give you the numbers of what is the keyword research you're looking at. And of course, for those who know even a little bit about keyword research and SEO, it varies from geography, it varies from region, it varies from topic. So based on what client you're writing for and what is the target audience and demographic, all of this has to be kind of understood. That is again where a content consultant comes into the picture, which need not necessarily be a doctor who is a content reviewer, but a marketing person. MBA in marketing would be someone who is being a content consultant. All of these tools are somewhere just like our digital assistants. They can't do the job for us, but they can help us do our job. And one has to remain updated, because, like I mentioned, you have to adapt to new tools. For example, for medical writing, medical content, Perplexity offers a better researched, better structured content than ChatGPT, and one has to know the difference between the two.
Well, that's quite a technicality that one must know, and obviously so, because it is a sort of a subject expertise that is there. How has this changed in the times of AI, particularly after the AI revolution which is going on?
This whole thing about AI. Now that you asked about AI, it's a bittersweet thing for us. To be very honest with you, we've seen it develop right in front of our eyes. We've kind of helped some programs do a machine learning on medical articles to be able to write with AI tools better. And of course, it did hit us. We started preparing our writers in our training workshops for AI tools, but most people thought it won't make any difference. Even if you have to check the recent numbers, sorry,
Hmm.
even if you have to check the recent numbers released by Claude, content writing, social media, graphic designing, coding. These are the four massive areas where AI has the maximum impact. So obviously in content writing, what has happened is AI has made content creation faster and cheaper. Most often not for free, but not necessarily better. Again, because we do so many articles a year spanning lakhs of words every year. So if we circle back to our conversation about the requirement for doctors as content consultants, what has happened is a lot of the companies who started generating medical content on AI came to realize that authenticity comes only from the doctor. Human who is going to consume that content, whether it is created by AI, does not trust AI. The humans who are reading or consuming that content only trust other humans, especially doctors. So AI generated content is also coming back to doctors for reviewing. And all of this content, whether because of legality or because of the trust factor, is getting published under a particular doctor's name only. So when I or a layperson reads XYZ doctor who is a specialist in PCOD has written about PCOD, they believe that content, they share that content, they engage with that content. Therefore, the doctor's role in content after AI, if not to write the content, it definitely continues to exist to review the content. But that being said, AI generated content, especially medical content, which, like we know, is a niche market, is at the end of the day a mass manufactured, machine based thing. So while it may seem cheap or affordable, there is always a demand for the Rolexes and the Rolls Royces of the world because they are tailor made, custom made, they are built for a reason, like they are handmade. Similarly, there is a demand for authentic, genuine content that is written by doctors because that imparts a vast amount of authenticity. It is far better tailored to the target audience, and often does not have the silly goof ups that AI sometimes has. More importantly, I think one what we have observed, especially in the last 6 to 8 months, when a doctor is writing this content, handmade, tailor made, custom made content. A doctor who is practicing has far more value to add to this content than an AI who has no clue of what the current patient scenario in a particular demographic is. For example, a doctor who is from Chhattisgarh or Ranchi will be able to write far better content for that particular demographic, which is better suited to what are the local delicacies or the local terminologies being used, which AI cannot compete. This is just one example. Vis-a-vis a doctor who is practicing every day and is well aware of the newer drugs or the newer diet fads that are going around in a particular locality, is able to talk better out of it out of sheer experience. In some sense, I feel what has given us the edge and kept us relevant today is over the past decade, TechnoMedix has always insisted in some sense, or at least ensured that the doctors who are writing with us are continuing to practice because that is how they stay updated and pun intended, they have their finger on the pulse, which AI cannot do. And I feel even in the times of AI over the past 2.5, 3 years, what has kept Technomedix relevant, even being a decade old company, is the fact that we are engaging with real doctors who have real information and a real passion for writing.
Wow. So then, if you could also inspire us with your own journey, if you could tell us something about, and because you've been very insistent on the doctor practicing while writing content, and that is what probably I have also seen you doing. If you could just tell us something about the journey.
So, Dr. Kevar, I think you are no stranger to wearing multiple hats, having multiple feathers in your cap. It's been very exciting to share this kind of journey with someone like you. For me, this started probably close to about 16, 17 years ago. Before that, like I mentioned, I used to write. I was always fond of writing, and I don't want this to be a reason for people to go back and visit those blogs which are full of errors and they're probably an immature version of me writing. But being active in the writing community, Probably there were a couple of Orkut pages there where we used to all collaborate. So when I was in medical college, I continued my writing for the college magazine, a few articles here, there, few debates, elocution, collaborating with and discussing with other batchmates and juniors about writing. For the longest time, ever since I can recollect, I had read this one particular book where I remember this African phrase that when the lion hunts, the jungle feasts. It sounded a little pompous to me initially, but then I came across another beautiful African concept called Ubuntu. To put it simply, it just says that alone you can walk, together you can run. So when these opportunities for serious content writing started coming to me towards the end of my internship, I always felt that this is something I should share and do as a team, participate in with as a team. I vividly recall two instances which started this journey in some sense. There was one very nice startup IT company who had entrusted me with a huge responsibility of a massive sum of articles for a particular amount that in those days is really mental on. But when I got that opportunity, I was very clear that I know a lot of other writers. I know a lot of other my doctor friends, my doctor colleagues, who would also benefit from this. And that particular project we did about I had four of my juniors and we got together and as a team we took that up. And around the same time, there was another homeopathy IT kind of an opportunity where there was again need for a lot of content. And I had five of my batchmates, some of them who were tech savvy, and we took up that opportunity also together. Over the years, this just led to this concept of team TechnoMedix, and the team part was always important. So I don't think I have, वो कहते हैं ना कि लोग जुड़ते गए और कारवां चलता गया. In some sense, it's the people who have brought me on through this journey. We started with some articles, some syllabus actually, some course syllabus. Then from there it went on to one website development. In that website we needed more content. From there we got another project for social media. Then we went into medico legal. For 2 or 3 years I was the editor of a medico legal journal. From there I think we went on to EHR apps. From the EHR apps we got some link to some more government projects. Then we did some brochures, we did a big presentations, we started doing a lot of presentations. Then there were some research papers, there were some case studies, and some or the other opportunity kind of kept coming itself all the way till now, where we are involved at some level in some if I may say so, some policies and some regulatory framework also, right? But it's the team that brought this forth. The effort, I mean, at some point you do feel that the pile that's on the table keeps depleting because you have more people with you. But what it also translates to is this energy that the people bring with them, the love that they brought for me. And I think I should take this kind of a platform to express my gratitude for all of those people who have been part of this journey. Every time we would have a doctor who would join our team as a content writer, he or she, about 3 or 6 months into the engagement, would always come up with a request, can I share this opportunity with, and sometimes a younger sister, some other colleague, someone somewhere that she's also, she just got married somewhere, can she also start writing? And we were always open to helping more doctors get into this, maybe guide them. What also worked is, while we were doing this part, a lot of these doctors used to come back to us with some ideas or some opportunities that, do you guys also do this? Do you guys also do that? From there, we got on to designing, to the end that we managed some medical 3D video animations, which we never thought, we ever wanted to get into. But we did that. So this journey is not mine alone to claim that I became a medical content writer. In some sense, I was a writer, I became a content writer, I became a medical content writer. And then we obviously learned when we started, when we started with the websites, we did not necessarily have a technical know-how of how it works. Myself, some of my teammates, we actually took up courses to learn technical courses, NIIT and all of that, to reach from where we were all individual freelancers working as a team, and to this organization that is now more than a decade old and has engaged with close to 100 doctors just in terms of offering them opportunities to work with us, and a countless number of other people in different roles and clients across the globe. It is a journey that has just been enriching and I'm just grateful that somewhere everything just kept falling into place. Doors kept opening, opportunities kept coming, and I think I just kept walking.
Fantastic, really inspiring. Uh, what is the difference between working freelance versus a structured organization?
You're bringing back some fond memories, Dr. Kaur, some of them a little painful, if I may say so. A freelancer is like a doctor practicing in a clinic vis-a-vis a doctor attached to a hospital. You have the luxury and liberty of opening your clinic whenever you want, shutting your shop down whenever you want. You're a freelancer. You're not answerable to anyone except perhaps the client. You take a deliverable from a client, you take a X number of days and you deliver, whether you're working at 2 in the night or 7 in the morning. But then you are a one man army, right? You are the one who's talking to the client, you're the one understanding the brief, you are delivering the work, you are editing your own work, then you are giving the work to the client, sitting with the client, understanding the changes, chasing the payments, which many times, because you're a freelancer, do not come through as expected. Sometimes it's months, sometimes they don't come in at all. But whatever it is for you and only for you. Whereas, just like what I mentioned, if you grow as a team, if you run together rather than just walking alone, you are spreading the bond, you're spreading the energy, and you get back more energy. The moment you get into a structured organization, like we have for more than a decade, we've always had this particular principle that it is always going to be people before profits, that we are all about the people, we are all about working with the people, helping them find their journey, because we have been blessed to find ours. And if you as a structured organization just start focusing everything on the profits, you will lose out on the people. This sounds very different and it seems odd, but for us we've always held, whenever I am in doubt, I just kind of close my eyes and recollect my few conversations with late Shri RNT sir, where the Tata Group as a company stands till date for somewhere having people over profits. And if they could do it for more than 100 years, sure they have faced their challenges, sure they face their backlash. Our journey has just started. We're just a decade old. But as we grew from this multiple small freelancers who are coming together and then forming a structured organization and taking it forward, while we retain people over profits, we realize that to have a company and make it run successfully, you need a process that kind of governs or guides, if not governs, the people. So we started building processes, and rather than be a one man army who's doing it all, you realize that you may have some skills. I may be skilled enough to write a code, I may be skilled enough to edit a video, which I have when I was a freelancer. But is that the best use of my time? When you move on to this structured organization, when you move on to a company growth, the thing that you are then growing is not just yourself, you're growing a whole platform. And as the whole platform, as the whole organization grows with all its people, obviously you grow with it. So you get to a point where you say that, hey, while I can code, so as an organization, your aim should be to ask yourself, are we delivering the best value to those who work for us and to those for whom we are working? And that means that I would engage with a website designer, I would engage with a coder, I would engage with an app coder, a graphic designer, and specialist medical content writers, specialist editors who would sometimes even edit my work because they have a better skill set and would perhaps deliver better content. While all of this sounds very altruistic, there is obviously a darker side or a difficult side to running a structured organization. Not just the freedom and liberty to work when you want, because now you are working under certain processes, but also you have far more responsibilities. You are somewhere committed and responsible to X number of people, their families, their livelihood, their growth that depends on you, which means there are certain challenges where you ensure that you make timely payments for maintaining the ethos and work culture of your company. But it is also then your responsibility to still keep chasing those clients to get payments which are sometimes 60-day cycle, 90-day cycle, And therefore, you learn new terminologies like cash flow and runway and roadmaps and whatnot. And it's a different ball game altogether, but I feel it is rewarding because it brings back so much energy, so much goodwill, so much positivity from a lot of people, and I find that a little more enriching rather than just one freelancer, which I was working just for myself.
Off the tangent, is that why you did MBA?
Yes, yes, absolutely, absolutely. So I have no qualms in admitting that I've had a few other organizations or a few other companies, few other projects apart from TechnoMedix that didn't perhaps do as well as they could have. And while TechnoMedix also, the people kept giving back the feedback, our own people kept giving feedback saying we could do this better, we could do that better. But I was finding myself shortchanged. This journey from being a freelancer to running a company is not the same. And obviously, I have no formal education the same. I'm a third generation doctor. I've never seen my father do that. I learned being a doctor from him. I was inspired to be a doctor from him. But this was my journey. And perhaps the only partner that I had in this journey, in both senses, in the company as well, was my wife, Dr. Kruti, who also is a doctor, right? But she has good business sense and a keen aptitude for business, but I definitely found that sorely lacking in myself. So whenever we are not sure of what we don't know, my one of my I think one of my core attitudes is to always be a student in life. I'm always curious. I always want to learn, and a lot of discussions with even Kruti actually made me realize that I am sorely lacking in business sense of actually running a company. And then when I had already faced certain amount of failures, and then when you have the responsibility of so many people looking up to you, looking forward to your vision, looking forward to executing it on a successful scale, I felt that weight on my shoulders in some sense that I am responsible to deliver better outcomes. So with this aim of delivering better as a person, as someone in charge of a business, as the CEO of a particular company, I definitely felt, and this may not resonate with everyone, and I'm okay with that, but I definitely felt I was not good at certain things. And I have no qualms in admitting that because I feel that's when you grow. And I was fortunate enough to have people who close to me who I could trust and could tell me that this is where I'm lacking. And I thought I should really improve upon it. And it did seem like a daunting task, but today I can assure you I feel the marked difference of the same. I can see the results of the same, and I'm sure you've also enjoyed watching our journey grow over the last couple of years after that. So yeah, I think that decision was somewhere to make sure TechnoMedix reaches the next level, and I as a person deliver and offer better value, and somewhere maybe match the skills that my partner actually brings to the table.
That's quite a humble opening up of sorts. Now, see this next question. No, I feel even doctors, who are going to watch this, and maybe probably anyone going to watch it, बहुत काम का है ये सवाल उनके लिए. And see if you can put it into your own perspective. Although it is about the challenges that TechnoMedix faced, but I think that if people are able to put it into their perspective, certainly it will be of help to them. So, Dr. Suraj, if you could share the challenges that you have faced in content writing as a company, TechnoMedix.
So the company has its own set of challenges, whether it is sometimes managing cash flows or staying true to the ethos of profits, people, processes. But sometimes certain projects always bring about certain challenges, which as a person, as a writer, now rather than talking of what we did, I think I would rather share of what people can avoid. One of the challenges is, as you are aware, as a homeopath also, when we graduate from college, our batch size is askew. You have far fewer males as opposed to females. For more than a decade, we've had this work from clinic policy, which is not new. Work from home came in COVID. But even when we started originally, the whole concept was that the doctor must try and continue practice. Initial days of practice are always tough. You don't meet rent very easily. Not everyone is blessed or fortunate to have a clinic space, so you have to go out. And my wife and also the partner at TechnoMedix, Dr. Kruti, always had this as one of her core missions, that she wanted to make sure that all these women, all these girls who have spent so much time and energy studying, whether it's MBBS, whether it's BMS, whether it's BHMS, whether it's even BDS, you'll be surprised at the number of BDS writers that we have. They are not able to practice because they are not able to make rent. But TechnoMedix ensured that somewhere we fix a number and ensure that they manage to earn as much to be able to make rent and continue practice. What happens in this whole scenario, Dr. Kevar, is that 90% of our team is doctors, and of that 90% team of doctors, 90 close to 90% are women. So here the challenge, which maybe a lot of your viewers are also based on your recent Instagram metrics, it does seem like that, right? The challenge is they have far more roles and responsibilities than we can fathom or learn to appreciate at times. The expectation versus reality is a little different when it comes to there. For them, when they start content writing, we know for a fact so many of our writers, they sometimes wrap up all the household chores, and after the kids have gone to sleep, will shoot up their iPad and start writing for a few hours at night. And as a company, we have to be flexible to be able to allow them to do that. So we can't set unrealistic deadlines. Our project management team cannot expect submissions at 6 p.m. at end of day, right? The project might get submitted the next day, and we want to encourage that. But this then becomes a significant challenge. Second, like I mentioned in the earlier part of the three-legged stool, where adaptability is a very important part. So, for all the budding aspirational content writers out there, adaptability in the sense that sure, you may have been writing content that is getting published in your college magazine, you have been writing blogs, and when you share them on LinkedIn, you're getting a lot of likes. But you have to adapt to what is needed now from the client's brief. Sometimes we have writers who are fixed in their way of writing. They're actually very fixated that they write in a particular manner. But the client has asked for different paragraphs. This is a whole different target audience. We had a particular project where we had close to 1,000 blogs on all kinds of sexual disorders. A very large multinational corporation wanted to have a blitzkrieg kind of SEO strategy where they were trying to cover every single topic under the sun, such that it would kind of lead to their site where they had some other products to sell. But when we took on that project for these many number of blogs, it was actually alarming and shocking for us to see how many of our doctors were themselves not very well versed with this content. Proper medical content, but they were not very well versed with it. Some were not willing to adapt or even learn about it. And this hesitation or this lack of adaptability to learn new tools, to find better ways to write, leads to a very high attrition rate. They come in and they approach us, they want to be content writers. In less than 3 months, many times even 10 days after 2 articles, they feel, no, this is not for me. This churn rate is a significant challenge for a company like ours that tries to keep giving these kind of opportunities and making sure that this remains an open opportunity of sorts. At the same time, this is then a challenge for those who are seeking content writing, because they get disheartened very soon because they are not trying to learn or trying to adapt or trying to understand what the requirements are. It's not that it's just a simple work from home thing where you can just start with a laptop and start clicking some keys and things work. There is a learning curve involved. There are some soft skills that you need to polish. There are some new tools that you need to learn. Only if you're up for the challenge, after a period of 3 to 6 months, the rewards will start.
Any common issues that you have faced with writers? Any quirky experiences?
Oh, plenty. I have close to 100 doctors, each one with their own specialty and nuances. And literally, we have engaged with not just all over India, across the globe, Germany, Nairobi, Nigeria, Ranchi, Indore, Odisha, Kolkata. So everyone comes with their own, not to stereotype, but they all have their quirks. And it's fun, it's engaging at times, but sometimes they are so fixated in how they approach things, or they are doing, or they are working in a sleep deprived state. For example, there was this one where this writer wrote about anti-aging cream for teenagers. The brief was about anti-aging cream, but many times there was no keyword for teenagers. But I'm not sure what she picked up from somewhere. Multiple times throughout the article, it was anti-aging cream for teenagers, and it just did not make sense. The previous one where I mentioned, where we had sexual disorders, shockingly, one doctor was not aware that this particular problem is not applicable to males. And the entire article is talking about males and females, and then you have to wonder where exactly did they research from, because we always insist for links. And sometimes that's when we get to know that maybe there have been some other tools at play, like AI. Forget human fails, it's not to mock, right? Obviously, AI has hilarious fails. One of our most popular tools, when we would write about blood vessels, for example, every now and then it would suggest that the vessels should be reworded to either ships or boats, without being contextual that we are talking of blood vessels. So I could tell you a few more of these hilarious AI fails where they are changing the sentence that it doesn't make sense at all. But there are writers who know to write, but either are really bad at language, meaning they love reading. So they themselves, during the interview, they say they are voracious readers. So they love to read, love to get information. So they are brilliant in terms of the research and finding the right information. They're really bad with vocab. So then you have disjointed, structured sentences which make no sense. Formatting where tech challenges, where we have writers who don't press the enter key for a line break and instead go space, 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 space to go to the next line. You have writers who don't use the bullet points, instead manually type out one dot space. So tech challenges, language challenges, AI challenges. I think our editors would be in a better position to answer this question when they sit and the things that they really tear out their hair with. During our monthly meetings, we have a lot of these sessions where they also went out these common things. But in all seriousness, we try to give this feedback to the writer. We conduct some routine workshops on a monthly or a quarterly basis where we try to where we try to make up for their deficiencies. And when it still doesn't work out, we have to either call off that engagement. Then, which is why I think if you want to be a writer, content writer, medical content writer, you have to be willing to learn, willing to adapt, and be apprised of the trends. And you cannot work without tech.
टेक के बिना तो नहीं चलेगा.
टेक के बिना तो नहीं चलेगा. For all the content writers, budding content writers, aspiring content writers, I would say, I mean, as a writer myself, the value of a word, a spoken word or a written word, is immense. I am all for writing, right? The pen is mightier than the sword. Now, of course, the keyboard. But I don't think it's just typing words. I think you really deliver a lot of value when there is a particular brand or even a doctor who's trying to convey something. You're giving them a voice. You're conveying a message. The rights and wrongs and the ethics of it are a completely different thing. But what you are out there is you're being the voice for that brand when that particular potential customer is reading about a medtech device, that these are the features, these are the advantages, these are the not so good advantages, or whatever. This is the usage instructions, or whether it's a social media post, or even what we started with, whether it's this, the voice of the actual text that you're giving, which is true, where we don't want fear mongering happening in some sense. Then you are the voice. If you write a fear mongering message, you're going to convey fear and going to try and be a clickbaity message. If you write a scientific, well structured value addition of a blog, it will get shared, it will be useful, it will be liked. So, but that journey from being a writer to a content writer to a medical content writer, you will have to stay curious and adapt with the tech. You will have to kind of get used to these tools, understand these nuances, understand the brief better, right? And while I did say the pen is mightier than the sword, I will also say the words that you write have a power to heal, have a power to help, have a power to nurture, and have a power to convey. So I think it's a very powerful craft. which requires a fair bit of science and a fair bit of art. And as with any craft, you have to hone your skills. You're never there on day one. Don't back down from challenges. Don't be afraid to ask. Understand better. Be curious. What could I have done better? What was better required? And learn some of the tools, and don't fall into the trap of being very heavily AI dependent. The value is for the human touch, right? The trust, the authority is the human at the end of the day. So be human, be curious, and do understand that it comes with a certain sense of responsibility, because you do add a certain sense of value.
Fantastic, extremely illuminating, and like always, I say, very happy to have this conversation with you. Looking forward to more such. Do mention in the comments what is that you learned from this entire conversation, what is that you would like to learn more. Because the more you engage, we get a better feedback and we know what to serve you in the future. So thank you, Dr. Suraj, for being part of HomeOmithra Vartalap. Looking forward to having more Vartalap with you in the future.
Absolutely, Dr. Gior. Actually, it's an honor and a pleasure to be back here with you for the first time. We are doing it face to face. The last time was a virtual session, which just shows how empowering this can be, and your beautiful journey. More power to HomeOmithra Vartalap always. I am an ardent follower, and I love the way you bring out such interesting conversations. It just shows that while we are all bonded or bound by this one common thread of being doctors, there's so much that each one of us, have a perspective in some sense, or have a specialty in some sense. And some of the doctors that you've discussed with in the past, it has been a very enlightening experience for me. It just kind of motivates me to do better. And I hope that what we discussed today is, valuable to your very, very loyal listeners and followers. Thank you for the opportunity. Looking forward again, whenever you think we can serve the community better, at your service.
Thank you. Thank you so much.